Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. The new bill in Congress just passed. It's now law, and it's going to affect seniors in a variety of ways. How is it going to affect seniors? Specifically, people in San Diego. Here to talk about that is Junne Esguerra, and Junne is from the San Diego Seniors Community Foundation. Chris has been on before,
Yes.
And now you're here to talk about something that's near and dear to your heart.
Yes, thank you so much for having me.
Yeah.
Again, my name is Junne Esguerra. I'm the Director of Programs at the San Diego Seniors Community Foundation, and you're absolutely correct. This is very near and dear to my heart, and it should be for our community and the nation as a whole. We don't exactly know how this Medicaid reduction is going to play out necessarily, but what we do know is that Medicaid is the largest payer of long-term care for seniors. 2 out of every 3 people have Medicaid.
Wow.
Medicaid pays for their long-term care.
Okay.
And here in San Diego, 70% of seniors have Medicare or Medicaid as a healthcare benefit. 14% have Medicaid, Medicare. 51% have Medicare and another insurance. So here in San Diego, because we have a large veteran population,
Yeah.
Medicaid and TRICARE, so at least 70% of our
Yeah.
seniors are going to be impacted by this.
Yeah, for sure. I mean, so you already have a huge population of seniors. So we talk about percentages. If you look at raw numbers, it's huge, and it's only going to get bigger. And you were talking before we started recording about how many millions of caregivers we're going to be short in the future.
Absolutely. So we are currently in a national nurse and caregiver shortage. In California specifically, by 2030, we're going to experience a 3 million direct caregiving shortage,
Wow.
meaning paid caregivers. This is not just family caregivers. This is paid caregiving. 3 million by 2030.
That's a big number.
Yeah,
That's
in less than 5 years.
Yeah. So we kind of talked about how people's living situations is going to be changing because of this bill. And again, this is near and dear to your heart. Tell us about your story and the situation with your loved one.
Yes. In COVID impacted so many seniors, but it also had a direct impact on my family in that my mom had a series of 5 strokes in the COVID era, not just during lockdown, post lockdown, which really directly impacted her health, the social isolation, the inability to access nutritious food all the time, socialization,
everything.
really impacted her health. And now she's in a skilled nursing facility paid through Medicare and Medicaid.
Okay.
And my family is very concerned about how this will impact her care. Nursing homes are saying that they already are at a staffing shortage.
Right.
And with this new bill, it could potentially exacerbate that, forcing many to close or run severely understaffed.
Yeah.
And the cost for these placements is very expensive. It's nearly $10,000 a month or over $10,000 a month.
Wow.
Don't know the exact numbers, but for my mom here, all of her Social Security goes to pay her share of cost.
Right.
So we don't know how these changes to Medicaid will affect everyone, but we know that it's going to make accessing healthcare more challenging for those who are low income, most vulnerable. Having to pay more for healthcare is cost prohibitive for a lot of seniors.
I mean, you're on fixed incomes. They can't go out and get a job and then suddenly make up the shortfall.
Absolutely.
And if it's not coming from Medicare or Medicaid, then where does it come from? We don't know.
It's, some politicians say it's just going to have to rely on the family to take over. But for those in the sandwich generation who are taking care of children and trying to take care of their families and their own lives, a lot of that financial burden may come to the people that are still working, trying to make a living, that are still raising younger kids. Um, so, how does that impact people my age?
Right.
I'm a part of the sandwich generation. Thinking about that is very scary.
Yeah.
It keeps a lot of people up at night.
Oh, I'm sure. I mean, it's already happening now. I have a lot of friends who are raising their kids, or their kids are in college, which is not cheap.
Yep.
And then also helping to take care of their parents who, maybe no fault of theirs, were not able to financially plan for their retirement, and they're having to help make up the shortfall now, that may be even bigger. So you and I talked the other day, and it's like, okay, well, now what? So you've been kind of scrambling, making phone calls, checking in with people. What have you found?
My first conversation was with the administrators at my mom's living facility, and they responded with the overwhelming, "It's scary, but we don't know.
Yeah.
Um, we don't know how this is going to impact us, but we are already running at a very lean staff. They're already trying to operate um, on very low um, money coming in.
Right.
Um,
Head count is probably not there, as far as how many people they need. I mean, it's tight everywhere.
it is very tight. And then also, what are my options as a family caregiver? Do I look at my equity? Do I look at maybe foregoing saving for my child's college education? Um, what happens if I have to move my mother in? What happens to my job? These are all these things that people should be thinking about. These changes are said to come in 2027. That's less than 2 years away.
Right. It'll
Um,
be here before you know it.
absolutely. We um, we tell people to start planning for your retirement, start planning for your future. 18 months to make these dramatic changes is not a lot of time.
Right. Well, and especially if you're looking at options such as moving your parent in with you. What if you don't have room?
Right.
What do you have to do to make it safe? You have room, but you have a two-story home. You don't have a downstairs bedroom. How is mom going to be able to be mobile in the home? What kind of care can she have while you're at work? These are all things.
So my mom requires 24-hour care. My husband and I both work. So what happens during the 8 to 10 hours where we're away? Home care is very expensive. For a higher level of needs, for someone who requires some medical care, that can be in excess of $50 an hour.
Yeah.
And that is cost prohibitive for most.
Right.
So it is very scary to think about the quality of care for your loved one. And then also, how is that going to impact your life, our lives as a family? There's a
Yeah.
lot of decisions and information that we're still looking for to try to help make these decisions. And unfortunately, there's not a lot
that
of
certainty.
definitive information out there.
Right. And it's also going to come down to, like, the county has IHSS, in-home support services, but how much are they going to be able to be helping people if their numbers of people that they need double and triple? There's only so much money to go around. But like you said, we don't really know yet.
Right.
And so I think, like you said, start thinking ahead, because it'll be here before you know it, and we'll have to see how the changes come and what it means. The good news is you're with a great organization, so you get to be at the forefront of this information as it comes in. So the San Diego Seniors Community Foundation is a great resource. So look on this slide coming up, you'll see the San Diego Seniors Community Foundation and their phone number and website. Visit them, check them out, and we're going to have June back as this journey unfolds so we can learn more about the things you're doing and how it's affecting you and what other people might be able to do for their loved ones as well.
Thank you so much, Bryan. I really appreciate the opportunity to speak about this today.
Yeah, my pleasure.